Hello, my name's Simon. I'm the producer of a new series of podcasts brought to you by Reflux UK. In this series, we'll be exploring every aspect of reflux, the symptoms, the diagnosis, and the treatments that are available. We'll be speaking to patients about their experiences and the different kinds of doctors who are involved in the treatment of reflux. And with me now is Nick Boyle, consultant surgeon and expert in the treatment of reflux. In this introductory podcast, Nick will be giving us an overview. Nick, can I ask you how common reflux is and the types of symptoms patients commonly suffer from?
Well, I think the first thing to realise is that reflux is an incredibly common problem. Throughout the world, there are many millions of people who suffer from regular symptoms on a weekly basis. In the United Kingdom alone, there are several million people, and indeed, probably 4% of all GP consultations are for symptoms of reflux. And the fascinating thing is that at least half of all of those consultations are for patients who are going back at least a second or third time because they have persistent problems. So the standard treatment for reflux usually involves changing lifestyle or antacid medications, and the most common of these are the PPIs, and around the world, worldwide sales every year amount to $13 billion. So that gives you some idea of just what a big problem it is.
Thanks, Nick. So it seems like GORD or reflux is a much more common problem than a lot of people think. So tell me, how is it possible to get an accurate diagnosis for someone who thinks they have reflux?
Well, the issue is that when people think about reflux, of course, they always think about heartburn, maybe regurgitation, chest discomfort, indigestion. Those are the kind of things which people think about, and indeed those are the kind of symptoms which most doctors will think about when they're trying to make the diagnosis. But I think the really important consideration is, whilst of course those symptoms are common, reflux can cause many other symptoms too. So in some patients it causes what is generally known as silent reflux. So these are generally considered to be patients who have problems with their throat, and that might present itself with problems with the voice, or a cough, or a sore throat, or a bad taste in the mouth, or a lump in the throat, a whole host of potential questions which do not have to be present in conjunction with the indigestion type symptoms. And then there's another group of patients who have problems with their chest. Asthma, for instance, is far more common in patients with reflux than in the general population, and there's a small group of patients who can actually get lung disease, chronic lung disease, because of chronic reflux. So I guess what I'm trying to say is that reflux is a much more common problem than many people understand, and it can present in a whole variety of ways. And in order to make that diagnosis, we depend upon a clinical history, getting a really accurate history from people, and then usually doing a series of investigations. That usually includes an endoscopy, which involves placing a camera down the esophagus into the stomach to assess whether there's a hiatus hernia, and most particularly to look at the lining of the esophagus and make sure there are no problems either caused by reflux or potentially other diseases. And then today we have access to all sorts of new technologies which allow us to measure reflux accurately, both acidic reflux and non-acidic reflux, because another thing that people don't realise is that reflux, particularly the silent LPR symptoms, can be caused by non-acid reflux. So that's other components of the gastric juice which are beyond just acid. So that's enzymes such as pepsin and bile. So we can measure those. We can measure those things, and we can correlate them with patient symptoms. And we can also measure how the esophagus is working to make sure there aren't any primary problems with its motility. And all of those things come together to create a picture and allow us to identify those patients whose symptoms are secondary to reflux, but just as importantly, to sometimes diagnose other conditions which can cause symptoms which are very similar.
Thanks, Nick. I think people will find that incredibly useful. So I think we're going to wrap it up now. In future podcasts, we'll be looking at the different treatments for reflux, and some of those are medical, some of them are surgical. We'll also be talking to some patients who've suffered from reflux and the treatments that they've had and their experience. And plus Nick will also be talking to other physicians about those different kinds of symptoms that people suffer from. So I hope you found the information useful. If you want to know more about GORD, the diagnosis and treatment, please visit the webpage refluxuk.com and look out for the next podcast in the series. Thanks for listening.